Hello and welcome, everyone. Wherever in the world you may be joining us from, good morning, good afternoon, good evening. As always, it is a pleasure to have you join us for one of our Worldwide Health Staff Solutions presentations. This presentation today is an extra special one, and we're very excited to be joined by our friends from Rachell Allen, NCLEX Review. They've got some great information to share, some very encouraging information to share. So you are going to be in for time well spent over the next hour as we bring this presentation to you. My name is Ron Hoppe. I'm the president of Worldwide Health Staff Solutions. And as I said, it is our pleasure to be hosting this session this morning. I'm not going to spend a lot of time on formalities. We want to jump right in. I'll just point out that as we go through our presentation today, please feel free to enter any questions you might have in the chat feature or in the chat box on your screen. We will do our very best to answer your questions towards the end of our presentation today. And also you will see in the chat section in the upper, on my screen, it's in the upper right, sort of a yellow section. We call it our Post-it note. And here you will find information where you can actually connect live, with the Rachell Allen team through their website. There's a link there. And you can also connect directly with a recruiter at Worldwide Health Staff. We have recruiters standing by to engage with you live and in real time. So without any further ado, it's my great pleasure once again to introduce Dr. Rosemarie Pica, our good friend from Rachell Allen. Dr. Pica, good to see you again as always. Thank you for joining us, and I'd like to turn it over to you.
Okay, Ron, thank you so much for the introduction, and it's nice to see you too. Okay, looking forward to meeting you once again here soon, and we're excited for this webinar as always, together with your team. It's always a pleasure to, share valuable information to all the nurses out there.
Good. Well, thank you for that. And indeed, I think in about 2 weeks' time, I'm going to be in the Philippines as part of our world tour that we're doing, and looking forward to visiting with you there at the Rachell Allen Review Center. So, Dr. Pica, what do you have to share with our audience today?
So, what we're going to share today are the things that they need to know about the Next Gen NCLEX, because Ron, a lot of people, when a lot of nurses, when the Next Gen came in, they were so afraid that a lot of them actually hurriedly took the exam in March, and they did not wait for the Next Gen, but only to find out that the Next Gen is actually much easier. Now, there are a lot of apprehensions, there are a lot of fears, and that's why Jeffrey today, all right, will be sharing to all what's the difference between the Next Gen. And we have good news to all, because when the Next Gen came in, we have our number of passers has increased dramatically, all right? Yeah. So meaning our program proved to be aligned with what is needed for the Next Generation NCLEX, which is more on decision making. Okay. All right.
Yeah.
So that's what the NCSBN or the boards of nursing are expecting from the those who are going to work in the US. They want these nurses to have what we call a decision making capability and critical thinking. And that's why Rachell Allen has been preparing for that for the last 2 years. So that's the good news. And that's what we're going to share today.
Yeah, great news.
Yes. So let me know if we can Is there anything more that you're going to share with us, Ron, about the retrogression? A lot of the people are, wanting
Yeah.
to hear about it.
No, this morning we're going to focus on the next generation of NCLEX. In
Okay.
the latter part of our session today, we will have an invitation for everyone to join us. The October visa bulletin is really going to be key and very uh, informational and very informative as to what retrogression will look like in the next year. So we've
Okay.
already scheduled a webinar for September 27th with
Okay.
several of the leading healthcare immigration attorneys in the United States will be joining me for that session.
Wow.
Uh,
That's
we
great.
we expect that we will not be able to accommodate everyone that would like to attend because we're limited to 5,000 attendees. And as of today, we've just started promoting this very important event, and we already have more than 1,500 registrants. So,
Wow. That's awesome.
so
All right.
we'll be sharing all the details on how our guests on this session today can also register at the conclusion of this webinar. But for now, the time is entirely yours.
Okay, thank you so much for that. So I would be asking Jeffrey now to share how Rachel Allen can help, okay, all the nurses out there who are waiting to join Worldwide Health Staff, okay, how we can help them pass the NCLEX, all right, easily, all right, with the Rachel Allen NCLEX review program. So I would now like to invite Jeffrey, okay? So thank you, Ron, for this free webinar. Thank you always for partnering with Rachel Allen. It's
All
nice
right.
to see you again.
Yeah,
All
and you.
right,
All
so
right.
I'm going to invite Jeffrey. Can you hold
Okay.
on?
All right. Very good.
All right, thank you so much, Dr. Pica and Ron, for having a very good introduction before we begin our session for today. All right. So, as Dr. Pica and Ron have emphasized earlier, our focus right now is to give our participants, our registrants, to know more information about the next generation NCLEX. And Dr. Pica is correct. There has been an observable tremendous increase in the pass rate, and I think NCSBN have already released a certain information about that matter. And one of the reasons why Rachel Allen is now producing tremendous high pass rates for our students who pass the NCLEX exam is simply because the program that we are currently implementing to all of our candidates are technically in sync with what the NCLEX wants to assess for each candidate, and that is about for what? For evaluating the critical thinking and clinical judgment of a certain nurse. All right. So, is everybody ready to know about these information regarding your next generation NCLEX? Yes or no? All right, because I think we have different participants from different parts of the globe, and your Rachel Allen family is now excited to guide you in this journey for you to be able to prepare your NCLEX the right way. Okay, good. So the first thing that we want to emphasize in terms of your next generation NCLEX is this. I have a question for you. Should we afraid of the NGN or your next generation NCLEX? The absolute answer is no. There's no way for you to be afraid to the NGN examination. Why? Very simple. Because number one, as long as you know the right content for you to be able to master a specific topic, you'll do fine. Number two, if you undergo a program that can help you tremendously in understanding the right amount of information that's necessary for the exam, you will be able to to ace the exam or to ace the test. And the last one, you should not be afraid of the NGN because at the end of the day, what matters most is with the right preparation and with the right amount of content, you'll be able to answer questions, right? Even if it's a case study or a standalone item that NCLEX may give you. All right. So, what are the things that we need to bear in mind or expect in terms of the NGN? Okay. Number one, we're going to be utilizing or they're going to be utilizing the current exam flow, meaning They will still use a computer adaptive testing to measure your ability if you pass or fail the examination. Second, they're going to be introducing new question formats, as you can see on the presentation, such as case study and standalone items. So we want to inform the public that there is no new NCLEX. They just added new set of question formats that they're going to be used to evaluate the level of critical thinking and clinical judgment of a candidate. I repeat, there's no new NCLEX. It's simply an enhanced or modified NCLEX wherein they will still ask existing questions, all right, question formats that they've used before, and they've added more questions, right, such as case studies and standalone items throughout their entire examination. So to wrap up what I said, it is simply a combination of your traditional NCLEX questions together with your new question formats that you will see in the next few slides. Okay, good. So what are those changes that may occur since April 1, 2023? Because I just want to inform you that NGN has been instituted since April 1, 2023, and even until now, all students taking the exam are still under your NGN type of licensure examination. Okay, so what are the things that you need to bear in mind in terms of the technicalities of your next generation NCLEX? Okay, before, your actual examination will give you about 6 hours, but right now your next generation NCLEX will give you a maximum time of 5 hours only. I repeat, maximum time of 5 hours only. The delivery method, or meaning the manner of assessing if you pass or fail the examination, will just be the same thing. They are using the computer adaptive test. So when we say CAT or computer adaptive test, it means that the computer will adapt depending on how you answer a specific question. Like for an instance, if the first question is moderate and you got it right, so what do you think will be the next question? The next question will be more difficult. That's how CAT works. Another example, if you encountered a question that seems to be easy and you got it right, obviously the next question will be moderate. But if you got a moderate question and you were not able to answer that question, from the principle of computer adaptive test, your next question may be way easier. Is that very clear? All right. So I repeat, the method of detecting if you pass or fail the exam will just be the same thing, and that is your computer adaptive testing. Is that very clear? All right. Good. The total exam length of your questions you're going to be exposed with on the actual examination are as follows. The minimum number will be 85 items. Okay, before it was 75. Right now, the minimum number is 85 items, maximum of 150 items, and you can stop at any number from 85 to 150. All right, I repeat, the minimum is 85, maximum is 150, and you can stop anywhere between 85 to 150 depending on your performance. Okay, and here's the most exciting part. Okay, so Jeff, where do I expect those full-length case studies or unfolding case studies will come out on my exam? Technically, first and foremost, each candidate will be exposed to 3 full-length case studies. When I say full-length case studies, one case study will entail or will cover 6 questions that are interrelated or connected to one another or to each other. All right? So I repeat, each candidate will be experiencing to answer 3 full-length case studies. One case study will contain 6 questions that are connected or interrelated to each other. All right? And will there be NGN approved items already in here? Yes. Since you're going to be taking your NGN exam this time, expect those standalone questions and the new question formats will be seen on your actual examination. So Jeff, do you have an idea of what it looks like? I'll show you later on. So I repeat, the time allowed for your NGN examination maximum for each candidate is 5 hours. The delivery method to assess if a student passed or failed the exam will just be the same thing. It's about your computer adaptive test. Minimum number got changed, minimum 85, maximum 150 questions. And all candidates who will sit on the test will be experiencing 3 full-length case studies. One case study will cover 6 questions that are connected or interrelated to each other. So if you're going to be wrapping that up, you have 3 case studies. So 3 case studies, all in all, will give you 18 questions. And all throughout the examination, you're going to be exposed with the other new questions formats that NCSBN have been delivering to detect the clinical judgment and critical thinking of each candidate. All right? Sir, is there any exciting part that I need to expect for the NGN itself? Yes. Here are some exciting great news that I want to share with everyone. Number one, most of the time, if you have experience before the NCLEX, you are required to memorize tons of laboratory values, right? You need to know the laboratory values of hematocrit level, platelet, for example, certain values about electrolytes. So you're getting so lazy already to memorize those tons of information. But right now, NGN will give you the reference ranges for your laboratory values. Yes, you heard me right. There are some questions that will be used on your NGN that you will notice they will give already reference ranges for certain laboratory values. So meaning your purpose right now, your focus right now is to know how to interpret those values and correlate it to the case of the patient. Okay? And obviously, another exciting part is they enhance the scoring approach or the scoring method of your NCLEX examination. And later on, I'm going to be presenting to you these different types of scoring methods that you will really like. Okay? Because before, back in my time, when I took the NCLEX examination, it's simply all or none. So for example, in a SATA question, if the answer is 1, 2, 3, and 4, and I only answered 1, 2, and 3, automatically I will get no point. All right? But right now, they made some adjustments on that scoring system that makes your NGN even more exciting. Okay? Good. Next one. One of the things that NCLEX, NGN NCLEX exam will try to highlight right now is your case study. Okay? So just to give you a glimpse, your case study just mimics, right? Your way your client is trying to recover, for example, or trying to, lead to a possible complication along the way as you try to evaluate what's happening during his hospitalization. Okay? So when we talk about case study, number one, again, how many questions in one case study? 6 questions. And are those questions connected to each other? Are those questions interrelated to each other? Yes or no? Yes. All right. And Sir Jeffrey, I'm just wondering, what is the first question all about? What is the second question all about? The third, the fourth, the fifth, and even the last question on a case study. So I want to guide you properly, and I would like you to see this. Again, 3 case studies all throughout your examination, 3 full-length case studies, and 1 case study will comprise of 6 questions, okay? And each question have different purpose, all right? So listen, number 1, if you will encounter a first question on a case study, all the time, the goal of the first question is to be able to detect your ability to recognize cues. And when I say recognize cues, your goal is to what? For example, your goal is to know, is there an abnormal thing in here? Am I seeing expected findings in here? So the goal of the nurse right now is to delineate or to separate, for example, the normal findings or expected findings or abnormal findings or unusual observations that you have noticed to your client. So that is what we call your recognizing cues. Trying to identify what's wrong with my patient, trying to identify what is expected to my patient. Okay? So once you're done answering the first question, you will now move on with the second question of your case study, and that will cover your analyzing cues. Okay? When we talk about analyzing cues, it's all about like this. Once you've identified the data from the first question, the next question will be like this. What are those cues trying to tell you, right? What are those information trying to signify? What are those data trying to tell you right now? So that will be regarding your analyzing cues. So that will be about the second question. Once you're done with the second question, you're going to be jumping into the third question. And the third question is about prioritizing hypothesis. And on the third question, it's all about what? What do you think is a possible problem of my patient? Is that very clear? So I repeat, the third question on the case study will mostly or generally ask you like this: what do you think is the possible problem of my patient? So you're trying to identify a possible problem, a possible diagnosis, a possible issue that as a nurse you want to address. Like for example, is my client having a possible issues regarding fluid deficit? Is my patient having issues regarding pulmonary edema? So that will be related to prioritizing hypothesis. And once you've already identified what's the possible concern of my client, your fourth question will be about generating solution. And when we talk about generating solution, it's all about what? What is the possible plan, all right, that I'm going to be considering, right, in relation to the case of my patient? Okay, so it's all about generating possible solution. Okay, and the fifth question will be about what? Taking action. So right now, based from the data that I see, what is the most important thing that I need to execute right now? What's the most critical intervention that I want to emphasize right now based on the case of my patient? All right, and the last question is all about what? Evaluating outcomes. So if we talk about outcomes as nurses, do we want to assess if our interventions got helpful to our patients? Yes or no? Yes. Were the interventions effective or ineffective? Were the interventions applicable or not applicable? All right. Were the interventions given be helpful to the case of the patient? So that is the usual transition of your case study. So I repeat, your first question will be always about what? Trying to identify, is there any abnormal thing in here? Is there any information about expected findings to my client? Your second question will be about what? What do you mean by these cues? What do you mean by the symptoms that I see to my patient right now? And your third question is this: from the cues that you've noticed, from the assessment that you've noticed, right? What is the possible problem of my client? All right. And in terms of that problem, what are the possible interventions I can consider right now? And out of those interventions, you go with the fifth question: what is my client needing right now? So it's all about taking action. And the last question will be about what? Did my interventions work? Did my interventions get effective or not effective? Was it applicable to my case or not applicable to my case? So that is the transition of what we call unfolding case scenarios, or what we call your case studies. All right? So recognizing cues, analyzing cues, prioritizing hypothesis, generating possible solution, taking action to your client, and evaluating outcomes. Okay? And are you excited to see a sample question later on? Because for sure, Sir Jeffrey will give you a glimpse of one case study that will mimic these 6 areas of concern. All right? But before that, I want to introduce to you how these new formats will be looking like. Okay? I'll give you a tip. Okay? You will know that a certain question is an NGN related question or a new question format because your screen will be split into half. Okay, so a basic screen, you will see already info on the left side and information on the right side, and they're separate entities. So that's how will you know that you are now encountering a new question format on the actual NCLEX. Okay, so what are these, Sir Jeffrey? Are you excited? Okay, let's bring it on. The first one is what we call your extended multiple response. And if we talk about multiple response, is that your select all that apply? Yes or no? Yes. Do you love SATA? Do you love SATA? Yes or no? Absolutely. All right. Because, my dear, do we have any choice not to love SATA? We don't have any choice, right? You want to pass the NCLEX? Make sure you need to love SATA. Okay. And if we talk about multiple response or SATA, can you have an answer either 1, two, three, or all of the options provided to you? Absolutely. All right. But Sir Jeff, why is it called to be extended? It goes like this to make it straight to the point. It's extended multiple response because a single SATA question will give you already more than four, five, six, up to 10 options, depending on the question. Because old NCLEX, the previous NCLEX, will give you usually roughly about four, maximum six options for SATA. Right now, it can be seven options, it can be eight options, just like what you see on the board. Is that very clear? Right now, as you can see on the board, you have eight options. So that will tell you it now mimics your extended multiple response. And what did you notice? Did the screen turn into half? Yes. The left side, you will have the scenario. And the right side, you will encounter the questions being asked related to the scenario. Okay? Good. Next one. Another exciting part of your multiple response or select all apply is this, the scoring system. Because I told you earlier, the scoring system is technically all or none. Am I right? Good. But right now, in your NGN examination, okay, the scoring system will be right minus wrong. And I'll tell you that later on. What does it mean? Okay. Next one, extended drag and drop. If we talk about extended drag and drop, right, it's simply about what we call arrange in order. Meaning, as you can see on your screen, the table, the first table on the right side will contain the options necessary for the case seen on the left side. All right. It's extended because there may be some options that will not be used based from the case of your patient or based from the situation of your patient. So you need to be very careful on what option to choose based from the case of your client. All right. It's drag and drop because literally you're going to be dragging the option from the left side and drop it on the empty table. Is that very clear? All right. So I repeat, you need to drop your desired answer, drag it, and drop it to the empty table. That's why it's what we call your drag and drop. And again, be mindful, there may be options or choices that will not be needed, that will not be appropriate to the case of the patient. All right. Good. Next one is closey item. Closey item is just like a multiple choice, but a bit interesting because it is a type of question wherein you need to fulfill a certain thought in a statement. So the attack is this one. You need to click the drop down list button. And as you click the drop down list button, you will see the options provided on a specific sentence. Okay. So you're going to be simply clicking that one, the rectangle box that you will see there on the screen. You try to click it, for example, and automatically there will be options coming down, coming down, coming down from that area. All right. So it typically mimics your multiple choice question. Okay. So that is what we call your closey item. All right. Next one is your enhanced hotspot. If we talk about enhanced hotspot, the other term for this one is what we call highlight, to make it simple and straight to the point. Because as you can see on the picture, you are required to highlight a specific sentence or statement based from what the question is looking for, based from what the question is asking. Okay? That's why it's what we call your enhanced hotspot or highlight, because literally you're going to be highlighting again a specific statement, all right, based from what the question is asking. Is that very clear? All right. So that is what we call your enhanced hotspot. All right. Good. Next one will be your matrix or grid. If we talk about your matrix or grid, as you can see, there will be a table seen on your screen, and each option will have certain buttons. And what you need to do is to click that button in relation to that given option. Like, for example, vital signs monitoring every 4 hours. Click indicated if you know that based from the case on the left side, it's necessary for your patient. You click not applicable if you know that it's unnecessary. You click contraindicated if you know that this intervention may bring harm or may cause harm to your patient. Is that very clear? So that is what we call your matrix or grid. So it's similarly be liking as a multiple choice. All right? That each option you try to decide, you try to decipher, you try to consider, is it applicable to the case of my patient? Is it unnecessary to the case of my patient? Will this intervention bring harm to my client? So that is what we call your matrix or grid. All right? And the last two are what we call, like this one, your trend item. If we talk about trend item, my dear, look at the screen, please. It's trend because you're going to be seeing a succession of data, a turn of events, shall I say, in the case of the patient. So most of the time, it will mimic the usual clinical scenario that we are exposed with as we work in the hospital, that we see different data from different time and different dates. All right. And the purpose of that information is you try to decide, you try to analyze with the data that I see right now, is there any changes from my client? Is my client getting worse or is my client just the same thing? All right. So that's the purpose of your trend item. They will give you data, right? Different data in relation to time, in relation to certain dates. And your goal, our goal, is to identify what's going on with the patient. All right. And based from the data, you answer the question seen on the right side. Is that very clear? So trend is about what? Succession of information related to time, related to dates presented on the data. All right. And the last one is what we call your bow tie. It's termed to be bow tie because literally, look at the question on the right side. The question looks like a bow tie. The boxes that you see mimics a bow tie. All right. Good. So what is the goal, Sir Jeffrey, in here? Same thing. Okay. Your bow tie will try to address all those 6 areas of concern that I've talked about in case study. That is why the goal here is to make sure that you have carefully evaluated the case of the patient. So you will notice like this. The setup will always be like this. The middle part of the box will always be about the potential problem of my client. All right. So based on what you see on the scenario on the left side, you try to consider, is it wound infection? Is it a possible compartment syndrome? Is it a possible DVT? And you just choose one because you only see one box from up above, right? So drag that option and bring it up. Okay. You go with the left side. You try to identify what's the possible intervention that I wanna indicate right now, considering the case of the patient. Okay, so you need to choose 2 interventions necessary for your client depending on the case that you have identified, of course, right? And on the right side of the screen, you will notice 2 boxes that may reflect parameters to monitor. So meaning based on the case of your client, what additional data that you want to check on, right? Based from the options given to you. So you see 2 boxes, so meaning you're only required to choose 2 options. You see 1 box in the middle, so meaning you're only required to click or to choose or to drag 1 option. On the left part hand of your screen, you will see 2 boxes under actions to take. So what does it mean? It means that you're only required to choose 2 options. Is that very clear? All right, perfect. Okay, so those are the questions that you may encounter on your actual NCLEX, right? Your bow tie, your trend items, your enhanced hotspot or highlight, okay? Your closing question, your type of extended drag and drop, and your extended multiple response. But I think the most exciting part is the scoring method, because this is now the time I'm going to be explaining to you on what are the things that we need to consider, how NCLEX may grade your answers on a given question. The first type of scoring system is what we call your 0 to 1 scoring model. So Jeff, in simple terms, what do you mean by 0 to 1 scoring model? It's simply all or none. So meaning if you got a certain option correct, you get 1 point. If you didn't get it, you will not have any point to be garnered. Is that very clear? For example, on the first row, you got 1 point. You got it correct, you have 1 point. On the second row, you got it correct, for example, you got 1 point. But look at the fourth row. The fourth row, you didn't get it right, so you will have 0 point. You don't have deduction, you'll just have simply 0 point. So add it up. In total, you're going to be having what? 1, 2, 3, 4, 5 points. So that's all or none. So meaning, if you got the option right, you get 1 point. If you get the question wrong, you get no point. I repeat, in 0 or 1 scoring model, if you get 1 point, if you get 1 point, if you got it right, you get 1 point. If you didn't get it right, you get no point. Is that very clear? All right. Another exciting scoring method that they will use is what we call your plus minus scoring model. In layman's term, this is what we call right minus wrong. For every correct answer, you get 1 point. For every wrong answer, you will be having a deduction. Is that very clear? I repeat, if you get a specific question correct, you get 1 point. If you get a specific option wrong, you will get a deduction. Is that very clear? Like for example, look at the first option. The first option, you got it right. So you get 1 point. You will garner 1 point. However, you click the third option and it's not part of the correct answer. So if you will include 3 in your answer and that is wrong, you will be deducted by 1 point. Is that very clear? All right. You get option 4. You got it right. So you get another 1 point. Okay. Next one. You didn't answer 5. Good thing. You didn't answer 6. Good thing. You answered 7 and you got another 1 point. All right. So in total, you get 3 points. However, you've included one option that's not part of the answer. And what's the agreement? If you've included one option that's not part of the answer, you will get a deduction per option. So you only include one option that's not included in the answer, so you get -1. So 3 minus 1, you will get 2 points. So the good thing is what? You can still have a point. Is that very clear? All right. So that is what we call your right minus wrong. And the last one is what we call your rational scoring. If we talk about rational scoring, it goes like this. Okay. For you to get 1 point, both areas should be correct. I repeat, in rational scoring, for you to get 1 point, you need to make sure that both of the questions presented to you, you will get it right. Sir Jeff, I have a question. The first part, I got it right. The second part, I got it wrong. Will I get 1 point? No, you will not get 1 point in your rational scoring. Is that very clear? So I repeat, if the question like close the item, that will definitely require you a rational scoring. So you need to make sure that if you have 2 options or 2 questions in one sentence, you need to answer it correctly for you to be able to get 1 point. So let me reiterate for you. How many scoring methods do we have? 3. First up is 0 or 1 scoring method. It means all or none. If you get 1 point, you will get 1 point. If you didn't get the correct answer correctly, you will not given any point. Okay? Or any score. Next one is your plus minus scoring system. It's what we call your right minus wrong. For every correct answer, you get 1 point. For every wrong answer, you get a deduction of 1 point as well. Is that very clear? And the last one will be your rational scoring. For you to get 1 point, both answers should be correct. I repeat, in rational scoring, for you to get 1 point, both options should be correct. If one option is right and one option is wrong, will you get that point? Will you get that point? No. Is that very clear? All right, good. So these are the scoring systems that NCLEX will use on your actual examination. All right. So to wrap it up with you, here are some guides that we want to share with you. For you to be able to prepare for the NGN the right way, you need to get the right resources. Right resources will help you tremendously on enhancing your clinical judgment and critical thinking in terms of attacking questions on the actual NCLEX. Okay. Another tip. In studying NCLEX, you don't need to memorize a lot of things, all right? You don't need to buy a lot of books and read everything about it, okay? What you need to do is not memorize, understand the concept, understand the disease process, understand what's going on about the case of your patient, and try to adapt, right, based from what's happening to your client that's found on the question, all right? And most importantly, okay, with the right amount of information, you need to have the right amount of mindset. So you always portray a positive mindset, a mindset of a winner, right? A mindset that tells you no matter what the questions will come out in my exam, I will get it and I will pass the test. All right? Because I know all the participants in here are aiming to become a registered nurse, and we know that you will get it. We know that you will have what it takes to win this game. Is that very clear? All right. So, for you to be able to get the right feel of the NGN examination, are you excited to try one case study? Yes or no? Come on, are you excited? Yes or no? Yes. All right. So let's try to answer in case study. And I want all participants to engage with me, and let's all together try to answer these questions. Look at the board. All right. This case study will cover the concept of health promotion and maintenance. All right. Let's begin. Everybody, look at the left side of the screen. A couple presents to the urgent care clinic with their 27-day-old newborn. During the interview, the mother of the newborn states, "My baby has been recently been throwing up all the time, and it's really disturbing. He tends to be hungry and fuzzy most of the time." So the case right now, based on what we see, is that the baby is throwing up a lot. Is that the same as vomiting? Yes or no? Yes. So meaning the child's case at this point is that the patient is having vomiting episodes. All right? Good. Look at the physical assessment data found on the board. There's poor skin turgor, there's sunken eyeballs, and there's dry skin. Is that a usual sign of your dehydration? Yes or no? Yes. Is that a usual sign of what we call your fluid volume deficit? Yes or no? Yes. But look at this interesting data. Upon palpation, there is a firm, movable, olive-shaped mass. All right? So, if you're going to be going back with your nursing concept, if you see the term olive-shaped mass, do you remember any condition that is common in kids with that manifestation? Olive-shaped mass. Is this a possible case? Is this a possible case of what we call intussusception? No. Very good. Is it a possible case of celiac disease? No. Or is it a possible case of pyloric stenosis? Yes or no? Yes. Very good. Let's try to look at the vital signs. Okay. Vital signs will give you this amount of data. But right now, I want everybody to look at the question. Which of the following assessment parameters should the nurse further investigate? So with the case of your client right now, who's vomiting with signs of dehydration, all right, should you monitor or check for the weight? Yes or no? Yes. Very good. Should you monitor right now for abdominal distension? Yes or no? Very good. Should we monitor for developmental milestone? Let's see later on. Okay. Should we check for acid-base balance since there's vomiting? Correct. Is it necessary to check for peripheral edema grading? No, Sir Jeff, because the case is dehydration. You don't have fluid volume excess right now, but you have fluid volume deficit, right? Good. Is it necessary to check your CSF right now? What do you think? Based on the data? No. But can you include checking the electrolyte panel of the client, like potassium, for example, calcium, for example? Of course, because in dehydration, will the electrolytes be affected? Yes or no? Yes. Kidney and liver ultrasound. Do you think it would be necessary right now? Not yet. Is that very clear? So in this case, the assessment that we want to venture on right now is the weight, because there's signs of dehydration, abdominal distension because you're suspecting a pyloric stenosis, acid-base imbalance because of the dehydration, and electrolyte panel because of the dehydration. So what's the correct answer in here? 1, 2, 4, and option number 7. All right? So because of that, we will now move on with the next parameter, okay, or the next question. It says here like this: more data has been given, okay? Aside from poor skin turgor, aside from sunken eyeballs, it says here that there will be gastric peristaltic waves that moves from the left to right across the epigastrium. So is that mimicking what we call stomach contractions? Yes or no? Yes. And based from all the data that we've found out, okay, another data has been given, electrolyte panel. And based from what we see, you have a reference range in here, and you will notice that the sodium is fine, but the potassium is low. Because it says here, the normal parameter is 3.1 to 5.1, and the data is 2.9. So it's technically low, right? Calcium of 4.4, that will be slightly low. Magnesium 2.3, that will be fine. All right? So look at this picture. This type of image will reflect a possible case of pyloric stenosis. And everybody look at the second picture below the screen. So that's the case of pyloric stenosis. There is thickened pyloric muscle that enables the food to pass through your duodenum going to your small intestine. So technically, the food will stock up. The food will stock up on the stomach, causing certain symptoms. All right? Good. So let's try to answer this question. Based from the data that we have right now, which of the following finding may indicate that the client is suffering from pyloric stenosis? Okay, so I will guide you. Let's click applicable if it's applicable. Click not applicable if it's not related to what you're looking for. Is magnesium affected in pyloric stenosis? No. Okay. Is potassium of 2.9 applicable in pyloric stenosis? Yes. Why is low potassium connected to pyloric stenosis? Because of the vomiting. Kids with pyloric stenosis may suffer from vomiting because their stomach got full with food. Therefore, they have a tendency to throw it up. Therefore, your client is having a probability of hypokalemia. Sir Jeff, can I include dry skin as applicable? Yeah, because is dry skin a usual indicator of fluid volume deficit or dehydration? Yes. Can I include projectile vomiting? Yes. We need to include projectile vomiting as applicable because, again, the food in pyloric stenosis got stocked up in the stomach. It will be filled with a lot of food. Stomach contractions will occur. The food will come out to the mouth, causing vomiting. Will there be hunger? Yes, because after that vomiting episode, the child will be obviously hungry. All right? Gastric peristaltic waves that move from right to left, this is not applicable because it should be left to right by what reference, Sir Jeff? Based from the data that you see on the case. That's why it's very important to be vigilant on the case. All right? Weight gain. Do you expect that there will be weight gain in here? Do you expect that there will be weight gain, Sir Jeff? They're vomiting already. So I don't expect weight gain in here, but rather weight loss. All right? Calcium of 4.4. Would that be technically affected in here? Not that much. It's mostly your potassium. So magnesium, not applicable. Potassium, applicable. Dry skin, applicable. Projectile vomiting, applicable. Hunger, applicable. Gastric peristaltic from right to left, not applicable. It should be left to right. Weight gain, not applicable. It should be weight loss. Calcium, not applicable. All right? So we're done with this one. So in this case, let's try to move on with this question. Okay? Based from the data that we have, still the same. Poor skin turgor, sunken eyeballs, the electrolyte panel will just be the same thing. But this is the nurse's notes. Look at the board. The child was noticed to have explosive projectile vomiting. Eagerly accepts a second feeding after vomiting. No bleeding was or were noted. So in this case, there's really vomiting and the child gets hungry. So therefore, let's try to answer this closing question. As a result of blank, so the pylorocircular muscle thickens. So is that relaxation? No, because based on the picture, it's not about relaxation, Sir Jeff. Necrosis, is there tissue damage? No. Is it inflammation or hypertrophy? Take note, you have a keyword on the scenario, thicken. So therefore, if it thickens, that's related to what? Hypertrophy. Is that very clear? So because of that hypertrophy of that pyloric sphincter, so this produces what? If it gets thick, will it be dilated or narrow? Come on. There will be what? Narrowing of the pyloric canal. That is why food cannot penetrate that area going to the small intestine. That's why the food got stuck up in your stomach. That's why causing the kid to suffer from vomiting, from hypokalemia, right? From stomach contractions and abdominal distension, of course. All right? Good. So in this case, based on the data that we have, all right, it's technically the same thing. The electrolyte panel will be the same thing, all right? And nurse's notes will be the same thing. So the question about here is related to surgery. And your client here, okay, is undergoing surgery to correct your pyloric stenosis, and that's your pyloromyotomy. So right now, we try to identify, is the intervention indicated, not indicated, or it may bring harm to the client, all right? Let's see. Vital signs monitoring every 4 hours, very good. This is indicated because the client needs to undergo surgery. Monitoring of baseline data is a must. Strict INO monitoring. INO means intake and output. Is that important in surgery? Yes. So let's click indicated. 25 ml Pedialyte. So that's for fluid replacement. Every 3 hours per RM. You are preparing a patient for surgery. Does your client need to be on an NPO? NPO. Yes or no? Yes. So right now, this is what? Contraindicated. Very good. IV fluids, it's indicated. Nasogastric tube, very good. It's indicated. For what reason? For gastric decompression, because again, the stomach of the baby is packed with food. Okay? Weight monitoring, it is indicated. Good job. Monitor for signs of metabolic acidosis. Take note, I keep on telling you earlier, is there vomiting? Is there vomiting? So therefore, if there's vomiting, will that cause acidosis or alkalosis? Come on. Very good. It will cause a possibility of metabolic alkalosis. Good job. You're doing fine. And let's try to move on with your second to the last question. Look at this. Which of these interventions can be delegated to a nursing assistant? So this is about delegation. Educating parents. Can you delegate that one to a nursing assistive personnel or CNA? No. It's the job of the RN for you to be able to do it. Taking vital signs every 4 hours. Yes, you can delegate that one to a nursing assistant. Parents are reminded. Very good. It can be delegated to a nursing assistant. Assisting parents. Very good. It can be delegated. Assessing. It's the job of what? RN. So we cannot delegate that. Changing sterile dressing. Is it the job of the nursing assistive personnel? No. All right. But it is the job of the RN. So what should be highlighted in here? Taking vital signs, parents are reminded, and assisting parents will be the job of the nursing assistive personnel. All right. Good. And the last part of our question is this. Look at this one. A couple presents to the urgent care clinic with the same data, but look at the nurse's notes right now. There is a succession of information. All right. It says here on October 4, 2022, the child progresses well and is tolerating normal breastfeeding within 4 to 8 hours with minimal vomiting. He is discharged with follow-ups in 2 weeks with their primary care provider. So the child has been improved tremendously. And here's the question. Which of the following information should the nurse consider that a child is progressing or what we call you're improving. Okay? Improvement from the client's condition. Is it one, vital signs stable, still with fever? Is it two, tolerating regular diet? Is it three, abdomen getting soft? Or is it four, not comfortable on per-orum pain medication? My dear, we're looking for what? Improvement. Is fever a sign of improvement? No. Is abdomen soft with tenderness a sign of improvement? No. So what's the correct answer? Number two. Very good. Tolerating the diet for 2 to 3 feedings. Because number four is not an improvement because look at the word, it says not comfortable. Is that very clear? All right, good. So here's a very quick example of the case study that you will encounter on the actual NCLEX. Is it manageable? Yes or
Yes.
no? Yes, as long as you know the right content. Is that very clear? All right. Is Rachell Allen ready to help you for your NGN preparation? Of course. That's why you can grab these information to give you further guide on how can Rachell Allen help you pass your NCLEX exam under NGN with ease and confidence. And with that, I'm going to be handing you over to Ron. And thank you so much for giving us this opportunity to give you some information about the NGN examination. Thank you so much.
Jeffrey, thank you so much for your enthusiastic presentation. I always enjoy hearing you and listening to your presentation.
Thank you.
I think if I sat in your classes, I would be able to pass the NCLEX exam. So
For sure.
So thank you very much for that. And thank you to all of our guests today for joining us. Tracy, I know we're right at time, but are there any questions at all that we might be able to speak to just very quickly?
Hi, Ron. Hi, Jeffrey. Yeah,
Hello.
I want to go ahead and welcome anyone to please drop a question you have in the chat. No, I haven't seen any specific questions yet, but we all know some of the popular NCLEX questions that we see. We see them almost every day, whether they come through our social media channels and those channels. I think a popular question that I see a lot is just talking about the next generation NCLEX. How much more difficult or not difficult is the NGN compared to the previous version?
All right. Okay. So based from the guideline of NCSBM, it's from the date of the NCSBM, the level of difficulty didn't change. Okay. So meaning the level of difficulty from the old NCLEX will just be the same thing for the NGN. But the good thing is that the exam right now is more manageable because the information that they will give to you are always on point, especially the case studies. You will always have a reference for you to look into and try to decipher what's going on with your patient. So that's why, to make it straight to the point, it's more manageable right now, but the level of difficulty didn't change. It's just the same thing.
No, excellent.
Terrific.
Thank you, Jeffrey. Yeah, I'm still waiting for some questions to come in on the chat. I see some great presentations. I see some thank yous for your
Our pleasure.
everything you did today. So it's really helpful, and your examples are incredibly helpful as well. Thank you for sharing that with our audience today.
Yeah.
So let me wrap us up then. We do want to keep to time. So thank you again to everyone who joined us today. Please know that you will receive by email video recording or of this presentation within the next 24 hours. And everyone who registered for this event, please share this recording with any of your friends or colleagues that you think would be interested in or benefit from this information. Please feel free to do that. Just a couple of real quick things. If you haven't already done so, please like us on Facebook. Worldwide HealthStaff also has just a fantastic referral program, and you can learn more about that just by clicking on the link here on the screen. And lastly, just to bring to your attention some upcoming webinar presentations that we'll be offering during the month of September. You can find information on registering on our social media channels. And particularly, I would draw your attention to the September 27th webinar presentation, where we're going to have the very latest update on the very important October visa bulletin and what that means for retrogression. I call that one out because our seating capacity is limited to 5,000, and we already have almost 2,000 registrants as of today for a webinar that isn't taking place for another month. So huge interest, of massive importance, the information we're going to be sharing here. So we encourage you to register for these webinars, and particularly the one on September 27th as early as possible. Jeffrey, please extend my sincere gratitude once again to Dr.
Mhm. Yeah,
Thank you
sure.
to you also. I'm very excited to be visiting with you and your team in Manila in about 2 weeks' time for information on our world tour. Please feel free to check out our social media posts as well. Tracy, thank you to you for moderating, and thank you to everyone that joined us today. We look forward to engaging with you again soon on another informative webinar session. Thank you, and bye for now.
Thank you. It's our pleasure. Bye, everyone.